My name is Travis Lovejoy. I'm an assistant professor in the Department of Psychiatry at Oregon Health and Science University, and I also work at the U.S. Department of Veterans Affairs Hospital in Portland, Oregon. My primary role is one of a clinical researcher. My clinical work focuses on the intersection of chronic pain management, substance use, as well as HIV and HCV infection. The particular therapy, teletherapy, that I was discussing in the workshop is called interpersonal psychotherapy. It's a one-on-one counseling approach, essentially, for individuals who are depressed, and focuses on their interpersonal relationships, so understanding depression within an interpersonal context, as well as how to improve social relations to hopefully reduce the depressive symptoms. And this particular intervention that I was discussing, we've tested in a randomized clinical trial, and it's currently ongoing. We're just completing the follow-up assessments for that particular trial. And we're seeing some promising preliminary results, and hopefully that those are sustained over the course of the longer-term follow-up. But the way it works is that these are the therapists who could be psychologists, they could be mental health counselors, social workers. They would connect with patients who are separated from them, typically by some geographic distance. So it allows individuals in rural areas who would not otherwise be able to access these services to connect with a clinician who has the expertise in this particular treatment modality. And, historically, most therapy, counseling therapy, has been face-to-face. And so I think that there's a certain expectation that when you engage in that type of therapy, that you're going to be seeing the person directly in front of you. I think that is changing with new telecommunication technologies, mobile technologies. I think we communicate more and more through our phones, through videos on our phones or tablets and things of that nature. So I think that it's definitely shifting the mentality of being able to do those things. And there are certainly proponents of it throughout the world of being able to do these telehealth interventions. But I think in part it just takes time and people having positive experiences and wanting to go back to it. So there are a number of different strategies to try to build rapport within the context of telehealth kind of psychotherapy interventions. One thing that we'll sometimes do is to try to ensure that we have an initial in-person meeting, so you have a chance to see the person face-to-face, and then subsequent meetings can be over the video conferencing or a telephone. I think that kind of sets a stage. It ensures that everyone can put a face to the sounds of the voices on the other line. When I don't meet with someone face-to-face ever, when it's exclusively over the phone, as was the case in some of the studies, the clinical trials that we've been doing, sometimes people will ask if I'd be willing to send them a photograph of me so that they can actually see my image. I tend to be a little more open to kind of self-disclosures if people want to ask those questions, and I understand that they can't see me, so they just want to know a little bit more about me, and I'm open to those types of questions. But I think it is a challenge to overcome. We have to be really sensitive to that, and what our own personal comfort level is with sharing and disclosing those types of information, which might not otherwise, be brought up in the course of face-to-face therapy. So there are some similarities when we're talking about working with individuals living with HIV who are uncomfortable going into their own community to receive this care, or maybe the care isn't available. It's not uncommon in the U.S., in rural areas, for individuals to seek their medical care in more urban settings because there aren't HIV specialists or even medical providers with experience working with people living with HIV in those communities. And so they feel more comfortable driving the long distances or somehow getting themselves there to be able to receive that care. So there are similarities within mental health, because I think that people, not only do they want a mental health provider, but they want a mental health provider with whom they can identify, someone who has worked with other individuals who are living with HIV. And I think that's why the interventions that we do are particularly well received by people living with HIV, because we have that experience. We can talk, like we get the lingo. We know the things, many of the things that they're going through. They can talk about CD4s and viral loads and not have us, question have to pause and inform us what that means and what they're discussing. Or they can we're oftentimes also very familiar with, other types of slang within someone is saying, oh yeah, I was out, I was out last night and doing crystal and whatever. I mean, we know what they're talking about, and so it's really easy for them to be able to communicate with us. And I don't think that they get that with traditional mental health services where they are now. Some of the other challenges that I see between discriminating between mental health or differentiating between mental health and medical care, certainly with medical care, so you can offer the verbal advice, but there are also certain things that medical practitioners will do when they have regular visits with their HIV positive patients. They're going to draw labs, right? They might be prescribing and so forth. And so depending on the nature of the healthcare system, someone might still have to go into a local clinic to have labs drawn, to fill prescriptions of that nature. And those can be very sensitive things. So having a local pharmacist dispense HIV medications might be very concerning for someone, whereas they would, even want to go into an urban setting. So that's one nice thing about the mental health piece is that, the telemental health, we are connecting over the phone, and there aren't any additional things that person in the remote location would have to do that would potentially out them as being HIV positive.